So, I'm talking today about, the heart. I gave you all my numbers from my blood work. 193 total cholesterol, HDL of 85, LDL of 100, triglycerides of 35, blood sugar 79, PSA 0.12. These are numbers. You can't get these numbers with drugs. 85 HDL for a male of 68 years of age. So it supports my lifestyle. I eat like Lance, my exercise like Lance, take the supplements like Lance. There's no drug that's going to do it. And it's cheap. It's cheap. Food, fitness, lifestyle. Now, here's something you may not have heard. This time of year, people get flu and, COVID. All right, this is posted from Youth Ravscom. He's a cholesterol expert. Just put out not that long ago. It says, on April 4th, a letter of mine was published in the British Medical Journal as a rapid response with the title, Cholesterol-Lowering Treatment May Worsen the Outcome of COVID-19 Infection. Now, listen to what I'm going to say here, okay? To be short, there is much evidence that statin treatment may be a major cause of serious outcome of COVID-19 flu. Now, let me say this first. Who are the ones on statins? Older people, right? See the correlation there? See the link? It says cholesterol of the patients who suffer from COVID-19 was lower than normal. LDL, the bubble that transports cholesterol in the blood, is an important member of our immune system because it adheres to and activates almost all microorganisms. You got that? And their toxic products. I bet you your doctor didn't tell you that. Statin treatment has been subscribed to millions of elderly people all over the world. There is much evidence that megadose of vitamin C may prevent COVID-19. There's also much evidence that treatment of patients with life-threatening COVID-19 infection with intravenous injections of megadose of vitamin C may save their life. And this is published in the Swedish Medical Journal. But I bet you haven't heard that. So it all ties into what I've been saying all along. Who benefits? Big Pharma. Statin drugs, one of the all-time best-selling medications of all time. And when the patents ran out on things like Lipitor, and Crestor and all the rest of them, they come out with a new one. A shot this time. Get your injection once a month. Repatha, I think it's called, to bring your cholesterol down into dangerous levels. And that the brain is largely comprised of what? Cholesterol, I believe, is 30% or 35% cholesterol in the brain. That's huge. Why? It's important. That's why. Why we're also seeing an increased rate of Alzheimer's in elderly people. What are they taking? Most likely statin drugs. When the real cause of coronary artery disease is not cholesterol, it's inflammation. And this is from Suter Health. This is Dr. Sinha. He's an MD. He says it's rampant inflammation that causes heart attacks and not high cholesterol, says the doctor, internal medicine doctor at Palo Alto Medical Foundation. In fact, more than half of all heart attacks occur in people who have normal cholesterol levels. Many of those people were diligently taking their cholesterol medications, but still doing things that contribute to inflammation, including eating the wrong foods, overstressing, sitting too much, and accumulating even more belly fat on a high-carb diet.